So now we are going to visualize a clinical presentation of the pathogenesis. So for the pathogenesis, these are the etiologies of malnutrition. We said that the etiologies of malnutrition can be divided into etiologies of acute malnutrition and the etiologies of chronic malnutrition. For the etiologies of acute malnutrition, you have protein energy intake, low level of protein energy intake. So in order for you to know low level of protein energy intake, both in acute and chronic, you ask for the nutritional history. Is it clear? The nutritional history is going to permit you to know for the protein energy intake. Actually, you should have a precise nutritional intake, for the acute, for the long run, and for the short run. If you're thinking of acute malnutrition, you should have a precise protein energy intake for a short run. Like, what was he eating in few days before? What about the protein? You ask the typical meals that they eat every day for the short run. And if you are thinking of chronic malnutrition, you talk of the meals that he has been taking since he has been born. For the long run, you should say about this, because this is more than 3 months. And you understand, you should talk about the breastfeeding, if this was on exclusive breastfeeding, if he has taken any artificial milk, if he was weaned, on what was he weaned. So those are the different things. So the child should not take adult milk by 6 months. It is wrong. They should take artificial milk. Is it clear? Like pre-formula, they like formula milk. Is it clear? It is not possible that this child take adult milk by this age, like nido in our context. Is it clear? So they don't take nido, which are adult milk, in 6 months. At 6 months, they should take formula milks, because those formula milks don't have certain proteins and certain antibodies which are not digestible. Is it clear? The next one is, you want to know if there's any parasitic infection or gastrointestinal malabsorption involved in acute circumstances. So you take a history of if there's any vomiting, any diarrhea, or any abdominal pain, for you to know if there's any malabsorption. And peculiarly, the sign of malabsorption, if you have malabsorption, the sign of malabsorption is going to be shown by steatorrhea. Is it clear? Steatorrhea. In addition to the diarrhea and vomiting, the diarrhea is going to be steatoric, meaning that it's going to have a greasy stool. The stool is going to be fatty, is going to be greasy. Is it clear? You have stools which are fatty or greasy, or which are slimy like lipids. Is it clear? It tells you that there is steatorrhea. Is it clear? There's malabsorption of fat. Is it clear? And this is but peculiar when you have malabsorption problem. If there's a malabsorption problem like that greasy fat for an acute period of time, it's an acute malnutrition. If it's a chronic period of time, it's a chronic malnutrition. Now, the next one are other acute infections. Like, you should ask if the child is having an acute pneumonia. You should evaluate for the signs, for the symptoms of acute pneumonia, symptoms of acute urinary tract infection, symptoms of acute meningitis, all those acute systemic infection, even acute malaria associated with a child not eating. Is it clear? All those anorexia may result in acute malnutrition. Now, also acute viral infection like measles, you find if the patient was have or other acute viral infection like which are presented with coryza in their prodromal phase. Is it clear? Coryza is an association of cough plus conjunctivitis plus catarrh. When you have cough plus conjunctivitis plus catarrh, those are coryza symptoms, or also called flu-like symptoms. Is it clear? And these flu-like symptoms peculiarly occur in patients that have viral infections. Is it clear? So that's the prodromal symptom of measles. And then later on, we have the enanthem phase of measles, which is associated with Koplik spots. The enanthem phase of measles associated with Koplik spots. Is it clear? You see whitish plaques at the level, whitish macules at the level of the oral mucosa. And then lastly is the exanthem phase. Exanthem phase is now when you have rashes of measles. So those are what you have to ask on physical examination to rule out measles. And for malignancies, you find for constitutional syndromes, what is particular for malignancy. And then you find if there is any sign of proliferation or like lymphadenopathy for the particular organ, and you have any mass located at any region. Is it clear? For acute malignancy. Now, to differentiate acute malignancy and chronic malignancy, you can ask for constitutional syndrome for a short period of time and long period of time. And also, you can also visualize for lymphadenopathy. Is it clear? Generally, lymphadenopathy for acute malignancy are going to be what? They are going to be tender. Is it clear? They are going to be tender. Is it clear? While lymphadenopathy for chronic malignancy are going to be non-tender. Is it clear? And they can be adhered to each other. Is it clear? So when you have non-tender malignancies, non-tender lymphadenopathies which adhere to each other, they are more of a chronic malignancy. But when they are tender and they don't adhere to each other, they are more of acute malignancy or acute infection also. Now, for the other infections, you have in the case of chronic, we have parasitic infection. To know parasitic infection like worms, you have to ask when there was the last time that the child was dewormed. Is it clear? Normally, you have to deworm after every 6 months. Is it clear? You should ask when was the last time that the child was dewormed. It can also depend. Some people deworm after every 3 months, some others deworm after every 6 months. You should ask that to find if there is any parasitic worm infection. So you should also evaluate if there is any social issue of TB at home. Is there any person having tuberculosis at home? You can visualize that from the social issue, and or you can also ask if the child was coughing for a long period of time before he came to this point in time. Is it clear? And then you have HIV. HIV, you have to find if there's anybody at home having HIV, particularly the mother, where there can be a mother to child transmission. And the last one, we have malignancy, that we've said that to differentiate between, to know malignancy, you have constitutional syndrome, and to differentiate between acute and chronic is particularly the lymphadenopathy that is going to be non-tender and is going to be adhering to each other. So those are the different things that we have to speak about on the clinical presentation for the pathogenesis or the etiologies of the acute malnutrition, of malnutrition in general.